Today's episode is tackling one of the trickiest, and let's be honest, most stressful parts of parenting and pediatrics: getting kids to eat. If you've ever felt stuck trying to figure out how to expand your child's diet without resorting to begging, bribing, or full-on dinner time drama, you are not alone. I'm Colleen, a PA, dietitian, and your nutrition mentor. Welcome to the Exam Room Nutrition Podcast, your guide to giving better nutrition advice. Now, as a pediatric PA, I guide parents daily in their journey of feeding their children, from starting solids to navigating picky eating, all the way through those emotional teen years. So today, my guest is answering the most common questions I get about feeding kids. Meeta Sharda is a registered dietitian, feeding expert, and co-creator of Happy Healthy Eaters. Meeta is full of brilliant, practical advice to help make meals less of a battle and more of a bonding experience. In this episode, we're diving into understanding why those adventurous infant eaters turn into selective terrors at age 2, and why forcing or bribing kids to eat never works, and what you can suggest parents do instead. We're going to be talking about simple ways to bring fun back to the dinner table. And spoiler alert, it might involve capes and breakfast for dinner. We also have some creative tips to introduce variety into your child's diet without overwhelming them or you, and how parents can model a healthy relationship with food even when life gets busy. This conversation is packed with actionable strategies to make mealtime a little less stressful and a whole lot more enjoyable, whether you're a parent or a pediatrician helping families navigate these challenges. So grab your coffee and enjoy my conversation with Meeta. Thank you so much for the gift of your time as a busy working mom. So thank you so much for being here. Welcome to the show.
Thank you so much for having me. I'm so excited. As a listener, we're just talking about how I've listened to every episode. So it's fun for me to get an opportunity to be here and chat with everyone.
I can't wait for my listeners to learn from you. I follow you on Instagram. I think that's how we met. And I had your partner in crime on earlier talking all things infant feeding. And this is you guys' bread and butter. And I love how you just educate parents, but you also help pediatricians. So it's going to be such a rich conversation. But I'm really curious to start as to why do these adventurous infants who seem to eat everything turn into picky toddlers? Like, what is happening here?
Yeah, there's quite a bit at play, and certainly depends on your baby's temperament for sure. But one of the big things that I try to make sure that folks understand is that when your baby is really, between ages of 0 to 12 months, they're going through a really rapid period of growth. I mean, their brain is just growing massively. They're often trying to triple their birth weight as well. And so they have high nutritional needs, right? And it doesn't mean that after age 1, they don't need nutrition. They do, but it's just at a different rate and a little bit slower, if you will. So that's one, understanding biologically, things are shifting. And then the other couple things that is happening is your toddler now has food preferences. And so children often have a preference for certain foods, often sweet tasting foods or things that might be a little bit more on the salty side. And so that's really normal. I mean, even as an adult, I have my own preferences. And then throw that in with a little bit of your toddler's desire for autonomy and independence. And that's really, healthy to have a child who wants that. But children, because they often aren't deciding what's on the menu, they're not grocery shopping, they may have certain opinions about the foods that we serve them. And so I really encourage parents, try to give your child some autonomy, like what plate they're going to be using, what placemat they get, what utensils they get. Is it like this cup or the straw cup? And that can just sort of help your child feel like they're exercising their autonomy. And then food jags and some neophobia, which, is usually the fear of both, familiar and new foods, is very hallmark in the toddler years. And it's just almost like a parental rite of passage that we just want to make sure we move through in the right way.
I think that's a really important thing, especially for pediatricians, to mention before it happens. I think to set that expectation up for parents. Now, I'm curious, how long does this kind of phase of curious and cautious eaters last?
what we're understanding is it can actually start anywhere between like 9, 12, but around 18 months, 2 years old is when parents start to see the list of preferred foods kind of dwindling a little bit. But it tends to last until around age 6. So, like, definitely into those school years. And I can speak from my own experience. My oldest is now 7, and he sort of was textbook. Like, he turned 6, and I don't know what kind of like light bulb went off, but he's so open to trying all sorts of new foods. But I also think it's that foundation of trust and respect between the two of us when it came to food that has kind of allowed him to sort of like detach and then go ahead and do some of these things. That's just like my experience, but I also see it in some of his peers and the other kids that are around his age. And that's not to say that some kids, certainly don't struggle with it well into older years or even into preteen years.
Yeah, it's a really good point. And I think that is the key when educating parents is it's a journey feeding our kids, and they're going to go through all kinds of different processes and learning stages and preferences. And so we do just kind of have to walk with them, helping them, supporting them, encouraging them, and really just not pressuring them too much or having any negative experiences with food. And like you said with your son, he's now a pretty adventurous eater, and that is a testament to how you've kind of walked with him along this journey. Now, I do want to get into some specific questions that parents actually ask me all the time. But one of those questions is, how much should my child be eating? And let's specifically talk here about like the toddler range, because we have done some infant podcast episodes, which I'll link down below in the show notes if you guys wanted to catch that. But let's talk about that because parents are really concerned that their child isn't eating enough. And so kind of talk to that and how we should help our parents navigate that.
Yeah, it's such a nuanced question to answer, but really what we need to do as parents is make sure that we're offering a wide range of foods, a couple times throughout the day, maybe 3 meals, a couple snacks. For some families, the snacks doesn't work, but what you want to do is have some eating zones and then, zones where it's like no longer time to eat and your child is going to be the one deciding whether they're going to eat and how much they're going to eat. And this all comes from a lot of the work around Ellen Satter and the division of responsibility. But I think for parents, we have to understand is if parents are coming into offices and expressing fear or worries, maybe they think their child's eating too much or too little, then what happens is the parent will often have interventions or change what they're feeding or how much they're feeding. And the child picks up on this. They pick up on this pressure or this scarcity. And then actually, it doesn't typically help the situation. It just sort of worsens that feeding pattern. And then parents are kind of even more worried and then implementing more strategies like a finish your plate or maybe more punitive action. And we don't want that to happen. So really letting your child guide their intake is really, really important. And of course, there's other parameters that can help support whether a child is getting adequate nutrition. And Colleen, probably even in your clinic, you do this where you're plotting growth charts, you're assessing growth over a longer period of time. We're looking at other like clinical indicators of maybe deficiencies, maybe doing up lab work if something comes up as a red flag. But really, we want to kind of look big picture and lean into trusting our child, which I know for some parents feels so foreign to trust like a 2-year-old, but it is really fundamental. And you want to think of it as your guiding North Star really in this feeding relationship.
I think that's a really great place to start. And you're so right. Parents get so worried about the fact that if they're wondering if their child is eating enough and how much exactly, like we love portions and numbers. Parents like find safety in that. And I think that's where that growth chart is really, really important. And also finding out if there is a variety of foods because they might be plotting fine on the 50th percentile, but surviving on macaroni and cheese and potato chips. You know what I mean? So I think both are really important to unpack with a parent. Now, I'm curious if you guys teach your families like a plate guide, like what should you put on each plate? That might be something quick and easy for pediatricians to educate their parents with.
We have an acronym. It's called FFPP. That's about as fancy as it gets, but we really encourage conversations around having, a source of fiber, that's going to come from fruit, vegetables, whole grains, having some fat because it usually helps to, delay gastric emptying. So it means it makes us feel full for a little bit longer. But fat is also tasty. I mean, it carries flavor molecules as well. And then for the peas, it's some type of produce. You can throw in like one or two, and then a source of protein as well. And of course, there's some foods that offer both. So, for example, salmon, it's a great source of fat and protein, right? But try to keep that acronym in mind, FFPP.
That's awesome. And I think that we, as pediatricians, we love acronyms and just something simple and quick to remember because it's so rushed. And we do want to provide that helpful tip to parents. And sometimes it's tough navigating that. So FFPP, I love that.
And it's
Now,
also culturally sensitive. Like every culture has sources of fibers and fats. And so sometimes I kind of find like the my plate, it's one style of eating, which isn't really representative of like the way that folks eat all around the world, right? And so I love that acronym. I think it does a really good job of just encapsulating the variety of foods we have.
no, I think that's really helpful. Now, I want to linger here a little bit because the other concern parents come in all the time is one of the P's, the protein. They always say to me that my child doesn't eat meat. And I, of course, then ask, what are you concerned specifically about? In my mind, I know they're worrying about protein, and we're going to talk about it because you know where I'm going with this. No, they should be worrying about a different nutrient. So
Yeah.
please talk to us about protein. How much do these kids need? And actually flip the script and what should we be educating our parents on with the nutrient that they should focus on?
Yeah. So we actually did a really good kind of like research in Canada. We wanted to see what percentage of kids are actually deficient in protein. And it was 0%. Okay. And so I think what we have to understand is that we're not so much concerned about children's protein intake because often if they're having like a cup of milk, some toast, maybe peanut butter, they're going to meet their protein requirements. But the key nutrient that often I'm concerned about is actually iron, which of course is in some protein rich foods, but it's not in dairy, right? We're going to find that mostly in our legumes, our pulses, so beans and lentils, but then also more absorbable form of iron, which is that heme iron in things like beef, in dark poultry, some fish, bison. And so I think parents can really, really relax a little bit about the protein. Like give yourself unconditional permission to just not worry about the protein and just focus in on sources of iron for your children.
So important. And yes, I agree with everything that you said because really their protein needs are so small. You know, it's not like adults who need anywhere between 80 and 100, 150 grams. You know, they're little bodies, they don't need as much. So put into perspective, like the grams that maybe, someone between 2 and 10 would need.
Yeah, it can really range depending on the size of the kiddo, but really they're going to meet their needs anywhere between about like 15-ish grams and maybe up to 45, but really like even 45 is probably like pushing it. So it's not as high as we would expect it to be like it is for adults. And of course there's nuance to this. I mean, if your child has an acute injury or maybe they, tend to benefit from, more protein earlier in the day for behavioral reasons, we can kind of adapt a nutrition care plan. And that's one of the benefits of working with a dietitian. But for the most part, I'm never, ever worried about protein.
Absolutely. And you said something there at the end that is crucial. That is the benefit to working with a registered dietitian because you guys can figure out the nuance. We don't have time for that in clinic, but I think giving that quick tip of like, hey, don't worry about the protein. Let's make sure we're getting enough iron. And, if the child is an athlete or like you said, there's some sort of an injury or behavioral problem, here's a referral to a dietitian who actually can give you a really personalized plan more so than I can in this 10-minute checkup. I think that's a beautiful conversation that pediatricians can have for their patients to set that child up for success. All right, I want to get into a few really practical questions and strategies for parents. And this again comes just from my experience working as a pediatric PA. So I would love to hear how you answer when the parent says, my child only wants pouches. Is that okay? And I'll kind of set you up for this patient. They were like 18 months, so under 2, and their growth was fantastic. There was no dips in the growth curve. I had no concerns at all, but they did say all they do is milk and pouches, and that's all they will tolerate. So Answer that for the parent. Is that okay? And what advice can I provide as the pediatric provider?
For sure. Let's answer the question around like what providers can do. I think understanding and ruling out, is there any reason why this child may not be able to tolerate or handle a more challenging texture? For example, is there a more of a mechanical issue happening in the mouth? In which case, maybe this pouch actually makes sense and we need to work on other developmental skills. But if we have a child, who is like just, typically developing and they're just on pouches, I'd say, 18 months is kind of pushing it. But even at 10 months, if that's the only texture that that child can handle, I would definitely encourage parents to implement strategies to offer more challenging textures or get some more expert or personalized feeding therapy happening, because we often talk about this like elusive like window of opportunity, and that window of opportunity for texture progression is around 9 and 10 months. So I find when I'm having a baby in my practice that's 12 months and hasn't progressed past periods, they really mourn the loss of it, and it's just that much harder for them to manipulate soft textured foods that are even as simple as like a banana or some moist rice. And so we really want to push through that in a way that also, is trauma informed, and like we're not, hurting the baby or making them feel unsafe, but just practicing the skills needed to chew, form a bolus, and swallow. It's really, really important that we kind of catch these babies. And then the other thing is a lot of the pouches on the market, some of them are really great now, I find, but they often don't have well-rounded nutrition in terms of that iron, zinc, and B12.
You make a really good point that although some of the pouches are fantastic and, you backed it up to when a baby is starting those solid foods, that might be a great option for on the go or at a picnic or something like that, because usually they are pretty nutritious. However, we're talking more about the development of the child and those chewing and swallowing skills that are lacking at such an older age. So I love that you mentioned that we probably need to assess for swallowing function and if there's any kind of developmental delay there first, before we just tell them, oh, no, they should be eating chicken nuggets and they should be eating pasta and everything like that. That's not really helpful. So
Yeah.
that's exactly what I did. I did refer them to a feeding therapist because, again, I didn't have the time to really get into the nuances. And I really think that that child needs to be evaluated for what's going on. He was also pocketing too, which is kind of also a telltale sign. They don't really know what to do with that bolus of food as they're swallowing it.
Yeah, no, 100%. I think like one other important thing is like even in conversation with a parent, is there anxiety or is there some kind of like irrational fear? And then working and coaching with the parent around that, because sometimes I think parents stick to the pouches because it feels safe. Maybe they saw their baby like have a near miss choke, or the gagging is really triggering for them, or maybe a parent is going through postpartum depression or anxiety, and food and food fears can manifest in really weird ways. So I think yeah, you're right. We can't just say, oh, move on without understanding what is preventing this family from actually moving on.
Such a valuable point, because as the primary care provider, we want to be problem solvers. So it's so easy for us to just give a solution. But I think if we can step back, like you had suggested, and really say, okay, what is going on with this family? And oftentimes it is something with the parent. They are dealing with a food anxiety. And you make such a great point that if there was that negative episode with gagging or a choking, that's really, really traumatic for a parent to work through. And so providing that support and I think asking those curious questions is really, really helpful to navigate if the kiddo really hasn't progressed onto solid foods at an appropriate age. Now, Nita, you guys have some really helpful tear sheets and things that providers can use. So I'd love if you can kind of just share what you guys offer.
Yeah, so we're happy to mail them out wherever you are in the world. And you can order a tear pad for well visits where maybe there's a discussion around, is your baby ready for solid? So it essentially is just this algorithm that parents can follow with the signs of readiness. And then there's another one that's kind of geared at toddlers. And it's if there's a conversation that comes up around picky eating and parents are like, oh, my child is like a picky eater, or like I never know what to make them. This is a really great resource because there's 5 tips for parents to kind of walk away with so they can help to support this selective eating behavior. So folks can order it. You just need to give us a few weeks. We usually just package it and then send it off to the post office.
So great. I think that's such a valuable resource because, again, we are limited on time. All my PA friends, that is the number one barrier they tell me when I ask why aren't they talking about nutrition? It's lack of education, confidence, and time is the number one reason because it's true. We don't have that time to really handle all of the medical things. So having those tear sheets, I think, is such a valuable resource. I'm going to link to that down in the show notes if you guys wanted to get those ordered. Okay, let's move on to the next issue that I hear all the time, and this is food throwing and the child who won't sit at the table. So kind of tackle those separately because those are usually separate instances. But what do we do for this kiddo who just takes the food off their plate and is throwing it or it's literally throwing the plate? How can we help parents navigate this?
Yeah. So I've been through this phase twice, and I think it's like one of the phases I liked the least. It was so frustrating, and I empathize with parents because food costs a lot of money, especially with inflation. So it's like so disheartening to see it then on the floor. But I think similar to the way I answered the last question is to figure out why is this happening. Sometimes we're expecting our babies and toddlers to eat and they're actually not even hungry. So of course they're, going to throw the food, or maybe they don't have the skills to like pick up that food. If we're giving them really, bite-sized small items of food and they don't have a pincer grasp, then they're kind of going to just swing it around. And then some babies are doing this by accident. They're actually not intentionally trying to throw the food. They are just still learning and practicing that coordination. So trying to understand why can help us to develop a bit more of that empathy as parents. But some tips that can be supportive is, number one is if your child is about to throw the food, what I encourage parents to do is like just kind of gently grab her and said, like, I see you're going to throw that. I'm not going to let you do that. The food stays here. Are we all done? We're all done. Okay. And then kind of removing the plate, and like the food still might end up on the floor, but the idea is you want to try to catch it before they execute the throwing. And that for sure can be tricky. If they have thrown the food, again, like use, some verbal or signing and just ask them, are you all done? When you throw food, you're telling mama you're all done. We're going to end mealtime. And then see how things kind of unfold. And some babies are like, no, actually, I wasn't done. Like, give that back to me. And then another tip, which is also takes a lot of repetition, is providing children with a discard bowl, or we call it like a no thank you bowl. I actually use that strategy, and it was fascinating because my son would like put the food in the discard bowl and then go back to it and eat out of it too. So it was just kind of irrational. I think he just needed like an extra vessel. And then lastly, and it's probably the hardest tip, is to kind of just even like ignore it and just trust that it will pass. At one time or another, your child will, no longer be food throwing, and it'll be really wonderful for you.
So much patience, right? Patience in parenting. I tell them all the time, whether you're dealing with infant feeding toddlers or literally I'm in the teenage world. So like I still have to have patience with parenting. So I think that's such a great final tip to just say it will get better and you will get through it. Now, I think another helpful thing, and this brings us back to one of our first questions talking about portion size and how much my child should be eating. Sometimes parents put way too much on the plate that's overwhelming to the child and maybe they're full. So can you talk to that as to like what would be an expectation for the child to be eating? And is that a reason that they may be throwing the food?
Yeah, for sure. I mean, I think so often when the food is perceived to be such a large volume, it's like, she wants me to eat that. No, not happening. And then, they're going to throw it. And so a few suggestions is just start off small, knowing that you can always refill. I'm talking like a couple tablespoons. And then another tip can sometimes be to just offer one food at a time and focus on that so that your baby isn't, or your child isn't so overwhelmed. But you're absolutely right that sometimes the volume of food just feels like it is too much, and you're going to have to really sort of lean into the cues and a bit of trial and error with your child, because you really are on this feeding journey that is not just going to last a couple of years, assuming your child will be with you for 18 years at home. It's a long haul. We talk about it really being a marathon. So just trial and error is going to be really helpful.
Yeah. All right, let's get to the kiddo who won't sit at the table. Now, I usually hear of two types of kids. One that just has so much anxiety, they won't even come to the table, to the point where it's like a temper tantrum and an all out, scene. and then another one who gets up and down quite often. So can you give us some strategies for each types of those kids?
Yeah, for sure. So, a couple tips is, if you have a child who's a mover, and this was the case for my oldest, is just constant moving. What we did was we would have like a dance party a couple minutes before supper, or I would like set up an obstacle course or let them use a sensory swing and just help them to feel like they got their wiggles out before they came to the dining table. And then when my son was also tall enough, I actually just removed the chair from his sitting spot and I put masking tape on the floor. And I'm like, you know what, sweetie, like just stand and eat, and that's fine. And actually, even at school, he uses a standing desk. So that's just who he is. And some kids really benefit from that. If you have a toddler, you could actually let them stand on their like learning tower if you have that and if it's safe, because that can again make your child feel a little bit more grounded. A couple other things that can help for children who, aren't sitting at the table is also just re-looking at your meal and snack schedule. Maybe the timing isn't quite right and you need to push it back another 20 or 30 minutes so that your child has time to build up that appetite and appeal for food. So they're actually eating the food that you're preparing. And then to the point about your child who's anxious about coming to the dining table, that's a little bit more tricky. And we're going to have to really, work with families to figure out how can we create a bit more of a sense of safety at that dining table and understanding like, is there pressure there? Maybe we need to actually just do like floor picnics or move to a different part of the home temporarily until they can feel some safety and security around being in that dining space. And sometimes I find working with an occupational therapist really helpful because they're so good at kind of assessing the environment and figuring out how can we make this a little bit more friendly for the child. So I think that type of a case would probably need a few more team members so that the child again isn't like coming to the dining table with all that adrenaline and then there's no productive learning that can take place. There's no way that they can, try new foods is really important.
Yeah, the child who's got, some fear to come to the table, usually there's a reason for that fear, and it is often because there has been, they've been struggling for a while, and I totally sympathize with parents with this because it is so frustrating when your kid won't eat what you prepared. I mean, I get it, but it's probably been years of bribing and spankings maybe, or, consequences, and the child, I wouldn't want to go to the table either if I've had those experiences. I think it's such a good point to involve other specialists here because this can go on for a very long time. And then we can have some micro and macronutrient deficiencies that we have some issues. So before it snowballs, I think that is a really important one to refer out to some therapy. The other thing that I have found that is helpful, and I love that you mentioned a floor picnic and just removing the table like out of it completely. As parents, we forget that kids just want to have fun. And if you can make food fun and just sort of change it up a little bit, they forget that they were scared in the first place and they're just excited to come and do this cool thing that mom is doing. And I found even like something as silly as like wearing a tie on your head or like funny socks, like just something that's like, what is mom doing? This is so weird, right? It just kind of gets them excited for the meal. So I think that's a really helpful tip to kind of do a picnic dinner. What other things or places can parents consider having like a meal?
Well, like to make it a bit more fun too, I find it helpful to do like everyone wear a cape or something or dress up is really fun. But in terms of where, like even outside, like if you have any kind of like communal space or even like an outdoor space, go outside. I think sometimes being in nature can also be really, really great. But, we just want to make sure that the place where you're eating is safe and it feels safe for the child. And I would even ask your child, like, hey, you know what, we're going to change it up on Thursdays. Like you get to decide where we eat and then kind of go from there, right? And then you kind of have a bit more buy-in from your child.
Oh, I love that. I'm going to start using that one. That's really great because again, too, you're giving them that autonomy and kind of like, hey, it's up to you. Like you get to choose tonight and they feel really special. So love that. Okay, I wanted to get into my last question, and it is also a big one, but I hear this again all the time. And it comes after I ask the parents, do you have any concerns with what or how much your child is eating? And they say this phrase constantly. And they'll say, I have to force my child to eat, and just kind of pause and look at me. And so What are your thoughts on that when they're telling me that they have to force their child to eat, and kind of where do we take that and provide a solution and strategy for them?
Yeah, absolutely. I mean, I think parents often have the best of intentions. So I never want to come across as like you're doing the bad thing or the wrong thing. But, you know, forcing your child probably isn't going to work in the long run. And I I talk to parents like think about your child at age 15 and 16 at school. Like you're not going to be there to force them. So what skills does your child need right now? And so I think it's really important for these parents again reach out to a registered dietitian but also understand that forcing actually undermines the trust between parents and children and that feeding diet, that feeding relationship that takes place. And you have to ask yourself, is this helping or harming, right? And and also doing a bit of reflection, like what are you the most worried about? Are you worried about growth? Are you worried about meeting milestones, about certain nutrient deficiencies? And sometimes reassuring those fears can be really, really helpful for parents. But certainly, like, we don't want to be forcing because now that I work with adults and with older children, their interpretation of those experiences is that it was trauma, right? And I think we have to learn from the folks that have experienced this and use it to empower conversations around what is a different direction that we can go that doesn't feel like you're forcing your kid to eat. Because again, it's not our job to get our child to eat. It's our job to make sure we're setting up an environment where they can be successful at eating with support or independently.
I think that's a great answer because, I mean, gosh, with everything with nutrition, it is so nuanced. That's why it's so hard to just give like this is the problem, do this. Well, like humans are complicated. So, of course, we can't just give a black and white answer. But I think you mentioned a really great follow up question to this statement when parents make it, when they say, I have to force my child to eat, is why do you feel like you have to force your child to eat? And just like you had said, are you concerned about how much they're eating, their growth? Are you concerned about their swallowing? Because that will then guide you into your further guidelines and your recommendations. And it might point out, okay, this child's got a feeding disorder. Okay, this child might have some swallowing issues, right? You can kind of navigate that a little bit easier. Now, what are some other final suggestions about increasing variety in a child's diet without forcing or bribing them?
One thing, and I'll say it two times because it's a little bit of a funny phrase, but I always tell parents we can increase our child's variety by changing what we serve when we serve it. So, what we serve when we serve it. So, if breakfast is actually like a really great meal, serve it for dinner. And I know that that seems like so strange for some families, but just even doing that can help to build out variety. So sometimes I'll even save leftover pizza and we have it for breakfast. Just again, like getting my kids to have that bendy brain and just be a bit more flexible. Another really helpful tip to prevent burnout of favorite foods is to just serve it a different way. So if your kid is really into Eggo waffles, cut it into strips, cut it into triangles, like serve it with pancake syrup and then maple syrup, like change it up and build out their variety within accepted foods. So if they like pasta, get different shapes and colors of noodles, or if they like bread, pick up pumpernickel and sourdough and raisin bread. So little tweaks like that can be really helpful. But I'd say my biggest suggestion is actually for the parents to make sure they are taking the time, because we're all busy, we're all like a little bit stressed, is to take time to make the foods that you enjoy. And what the research tells us is that when kids witness their parents seeking joy and pleasure from foods, those children will eventually grow up to enjoy those foods. And we see it. Like I grew up to enjoy caviar and sushi, even though I might have gone through some phases of selective eating as a youth, but we can move through it. But that modeling piece is so important.
Nita, you are just brilliant. You're just full of so many tips and tricks, and I just absolutely love it. So, thank you so much for all of the wisdom and clinical pearls that you provided us today. So, please share with us where people can find you on socials.
Totally. So I'm at Happy Healthy Eaters on Instagram, TikTok, Pinterest, Facebook, wherever. And then you can also visit us at www.happyhealthyeaters.com. And that's where myself and my partner, Jessica, we publish recipes and also blog posts on, nutrition topics that parents are often really interested in learning about.
And you guys also have a course. So tell me a little bit about that, and we'll link to all of that down in the show notes as well. But for those who are interested in going a little bit deeper or maybe providing this as a resource for their parents, tell me about what you guys have.
Yeah, we've got two courses. The first one is Start Solids Confidently, which is really geared at parents who are starting to approach solids with their baby and feeling a little bit lost, or maybe they've started and it's not going the way that they had anticipated. We've actually had a lot of physicians like take the e-course, and then also just for their own knowledge and for continued education. And then just recently we launched an e-course, and it's called Feeding Toddlers Confidently. And that really is geared at your child who's 12 months right all the way up to school age. And we cover things like weaning, what kind of milk to transition to, tips to manage selective eating, and what kind of changes when you go from having a baby to now this like child, right? And so those are the two offerings that we've got right now.
So great. I love that. And guys, definitely go check that out. I'll link to everything down in the show notes for you. Nita, thank you so much for your time. It was just such a joy speaking with you.
Thank you so much.
All right, now it's time for my nutrition notes. And today I want to focus on iron. Now, if I had $1 for every time a parent came to me worried about how much protein their child is eating, I would probably be on a beach somewhere living my best life. But like Nita said, most kids are getting plenty of protein. If they're very selective eaters, what they're likely not getting enough of is iron. And we know that iron is a big deal for growing brains and bodies. So here's a quick cheat sheet to guide your conversations with parents about protein and iron. Now, first of all, change the conversation to focus on iron. Remind parents, it's not about the protein. Let's talk about iron. So here's a quick recap of how much iron kids actually need. So infants 0 to 6 months need 0.27 milligrams a day. Infants age 6 to 12 months need 11 milligrams per day. Children 1 to 12 years old need 7 to 10 milligrams. Adolescent boys, 11 milligrams a day, and adolescent girls, 15 milligrams per day. So let's talk about some fun, kid-friendly foods that pack an iron punch. So you can suggest things like chili, eggs with tomatoes, peppers, or broccoli, spaghetti and meatballs with tomato sauce, bean burritos with tomatoes or salsa, orange juice paired with iron-fortified cereal, whole grain bread and peanut butter, French toast with mango slices, or oatmeal and strawberries. And for a little extra fun, sprinkle on some chia seeds. They're crunchy and they add more iron. And just to help parents visualize, here's how much iron some common foods have. So iron-fortified cereals are actually going to be your best bet. They have up to 18 milligrams of iron per serving. That's huge. Now, of course, you're just going to want to watch how much added sugar are in those cereals. White beans, a cup of white beans has 8 milligrams. Now, cashews, baked potatoes, beef, tomatoes, and a half a cup of chickpeas each have 2 milligrams. Now, finally, here are 2 quick tips to help boost iron absorption, and this should be part of your conversation in how you educate parents about iron. Number 1 is it's really important to limit toddlers' milk intake to about 16 to 24 ounces max in a day. Too much milk can block iron absorption, and it also hinders the child's appetite, so they will be eating less of these iron-rich foods throughout the day. Number 2, pair iron-rich foods with vitamin C-rich foods. Think oranges, strawberries, broccoli, red bell peppers, or tomatoes. The combo works like magic to help the body absorb more iron. So the next time a parent says, "I'm worried that my child isn't eating enough protein," you've got the perfect response. Let's talk about iron instead. Well, that's it for today's episode. I hope you've picked up a few nuggets to share with your families this week. If you did, send this episode to a friend. I would greatly appreciate you spreading the word about this podcast. Well, until next time, let's continue to make our patients healthier, one exam room at a time.